The views expressed on the Jerry Cahill CF podcast are that of Jerry Cahill and guests, and not necessarily those of the Boomer Esiason Foundation. Nothing on the Jerry Cahill CF podcast should be considered medical advice. Such advice can only be given by a physician who is experienced with cystic fibrosis. The Boomer Esiason Foundation, Jerry Cahill and guests cannot be held responsible for any damage which may result from using the information on this podcast without the permission of your medical doctor. You're listening to the Jerry Cahill CF podcast presented by the Boomer Esiason Foundation at jerrycahill.com.
Welcome to Jerry Cahill's Living, Breathing, Succeeding podcast series. This episode, My New Lungs, was made possible through an unrestricted educational grant from Novartis to the Boomer Esiason Foundation. It's April, National Donate Life Month, so today we'll meet a few double lung transplant recipients of all ages who talk about their experience post-transplant.
My name is Chris Dofer. I'm 45 years old. I live in Brooklyn, and I'm 3 years and I think about 4 months post-transplant.
Hi, my name is April Hansen. I'm 24 years old, and I'm a little over 3 years post-lung transplant.
Hi, my name is Jerry Cahill. I'm 60 years old. Post-double lung transplant 5 years. I was transplanted on April 18th, 2012 at New York Presbyterian.
My name is Michael Vamos. I am 19 years old. I had a double lung transplant due to cystic fibrosis at Newark, Beth Israel on March 11th, 2016.
Hi, my name is Andrea Eisenman. I'm 52. I had a double lung transplant at Columbia Presbyterian in April of 2000.
My name is Alvaro Vasquez. I'm 20 years old, and I am post-second double lung transplant, 11 months.
I was listed for a double lung transplant for over 10 years. The reason being, I was on the old allocation system. They started a whole new system about how sick you were. So combination 10 years, actively listed, waiting for lungs, 3 years.
For my first transplant, I was actively on the list for 30 days.
I was on the transplant list for about 3 weeks.
I was listed for 7 months at Duke.
On December 10th, 2013, I got transplanted, so that'd be a year. I was on New York's list and 33 days on Duke's.
I was on the transplant wait list for 6 years, and at that time there was no LAS score, so it was based purely on time on the list. For 2 years I was waiting in earnest and not sure I was going to make it. Finally, I got a call and we went to the hospital, but it was a dry run, and they said, well, you're high on the list. And then 10 days later, I got the call.
The process began with being in the middle of dinner and my phone ringing. They tell you, have your phone on and charged and with you at all times. So I answered the phone not really expecting anything, and I was told, hey, we have an offer of lungs. We need you at the hospital in the next hour. And I went, okay.
I was admitted to the hospital for kind of what at that point had become a routine infection that needed treatment with IV antibiotics. We have a set of lungs that are a match. We're going out to look at them for you. And I really wasn't that optimistic at this point. I'd been through the process of getting a call, we have lungs, going to the hospital, doing all the prep, getting the 20-some tubes of blood drawn, and then...
Sorry, it's not a go. But there was always a backup when you went for transplant. Most of the dry runs that I had, only one lung was good, the other lung wasn't. Well, I had 6 dry runs. I was transplanted on the 6th call. So it was kind of a roller coaster ride.
Ended up being, that was my 5th dry run. But then I was about to order lunch and they were like, no, don't order lunch because they're going to look at another set of lungs.
When I got the call, I was actually doing homework on spring break. After I got the call, I was like, I guess I don't have to do the homework anymore because I was going to be out for a while, so.
We bundled into the minivan and off we went. And I almost stopped her and took over the driving myself because she was so excited and nervous that her foot was going up on and down on the accelerator like this. And I said, Mom, I want to get there alive.
I said, yeah, we're coming in today because I had an appointment that afternoon, and she said, well, you need to come in earlier because we think we have lungs for you. So, we just piled in the car and took off.
And they told me that they had a pair of lungs ready for me. Possibly, because there were 2 other recipients, and I had to be in the city within 3 hours, and I couldn't believe that I needed to take a take back and run downstairs, catch my breath.
You would get a call, you'd go into the hospital, you'd get the basic tests done pre-transplant right before the surgery, and then you would sit and wait.
I didn't go into surgery till about 3 o'clock in the morning. I got the call at like 4 p.m. We didn't know if it was a go until I actually got into the room.
But I'd never known anybody that they said, okay, we're going to put the lungs in what they called the box that does a process called ex vivo lung perfusion that had actually ended up with a transplant from those lungs. But as it turns out, the night of December 9th and the very early morning of December 10th, they said, okay, it's a go. These are the lungs.
We waited for a while, took my first immunosuppressant medications, and it happened that day, March 30th.
I had 1 dry run, but I pretty much assume everybody's going to have a couple of dry runs, if not many. There are a handful that don't have dry runs, but they're the unusual case.
Because I had the false alarm dry run, I just thought, oh, this is going to be another one of those things. And I didn't get my hopes up, whereas the first time I did have my hopes up.
And I said, don't worry, Mom, the next time, that'll be the one. This was great rehearsal. And then it was, I think, 2.5 weeks later, came the next call, and that turned out to be the one.
I got there and everything moved really quickly. I mean, I got registered, I got put in a room, they gave me medications, and then they said, okay, we're a go.
I had my second double lung transplant on April 13th of 2016, and I had it due to rejection and all sorts of fungal infections in my trachea that dripped down to my lungs. I was in the hospital for 3 months, and every day was horrible. I wanted to get out. I wanted to get a transplant. I was waiting for it. I got the transplant call. They called me actually on April 13th while I was in the hospital bed. The second transplant was totally different. When they took that tube out, I couldn't believe it. I took a breath, a full breath. I cried. It was cathartic. It was beautiful. It was awe-inspiring. It was amazing.
The first thought I had after I woke up from transplant is I was just happy to be alive. I was happy that I made it through the surgery.
Well, because I was told sometimes you can wake up and be intubated but not get the transplant, I would keep asking the nurses or whoever were in my room whether I had the transplant. And I couldn't speak because I was intubated, so they would tell me to write it down, and then they would say, yes, you had the transplant. And it was a lot of relief, but I must have asked like 6 times because they were kind of like, I didn't even have to write it down the next time. They were like, yes, you had the transplant.
Well, when I first woke up, actually they kept me in a medically induced coma for probably 48 hours because when I first started to wake up, I started to fight and try to pull all the tubes out, so they put me back under. When I finally did come alive and wake up, it was a little weird experience. It felt like there was so much air in my lungs that I remember telling the surgeon when he came in that I think the lungs that he put in were too big. And he says, no, they're not too big, they're fine. It wasn't painful, but I didn't also feel that, oh wow, look at I'm breathing deep. It just I felt like a balloon. That's what it felt like. I had big balloons.
There is no time between when they say, okay, start breathing into this little mask here that they put over your face, and you waking up. You don't have a sense of a passage of time. So when all of a sudden I wasn't in a glaring white operating room and instead things were dark and I was in horrible pain, it was the best sign that things had gone right. Pretty much right after I'm alive was, I am never doing this again. That's how much pain there was initially. That said, all in all, if I had to, I will. Yeah, I'd do it again.
Well, I remember taking my first full breath.
It's the difference between drinking a milkshake, that it takes so much effort to get that up through the straw and into your stomach, and drinking water. Getting air in through my old lungs was like drinking a milkshake. Like, it took that much effort to get air both in and out of my lungs.
When I first got the breathing tube out, I sneezed right away, and it was a cannon. Obviously my chest hurt and everything, but it just felt like a cannon. It was like, that was the first breath I took, was a sneeze after.
There wasn't any one first big breath. It was a matter of bigger and bigger and bigger breaths over the next, I'd say, about 3 months.
Oh, this is what normal people feel like when they breathe.
My chest felt very open. I did a lot of walking and really worked on getting back in shape.
I felt free. I didn't have an oxygen tank strapped to my back.
And it took me a minute to realize I was breathing hard. And that's what felt great.
Nobody worrying about me. I was just out, breathing, running, walking, no coughing.
Not so much the deepness of the breath, but the fact that I could breathe in and out as fast as I wanted, and my body didn't feel starved for oxygen at all. That was that first exhilaration of having new lungs.
What I immediately noticed was how thin the air felt, that it didn't take conscious effort to get air in and out of these new lungs. The appreciation of that sensation is something that has never been lost on me and that I've never forgotten.
I honor my donor by taking care of these lungs. And I feel like as long as I keep breathing, she's somehow around. And I try to do that by exercising a lot.
I honor my donor by trying to push myself to do newer, different things. The next thing that I want to do is actually take a glass blowing class or workshop, because that takes a lot of lung strength and power to be able to work the glass.
My fiance and I both volunteer for Live on New York, which is the local organ procurement organization for this region. And there's a lot of work to be done. New York is last in the States in the percentage of population signed up to be a possible organ donor.
To honor my donor, every month on the 11th, my mother and I go to see the sunrise at Sandy Hook in New Jersey.
I pretty much like to live relentlessly, and I get a lot of living in there and giving back to a lot of people. So I live a lot.
I'm eating a lot more, I'm exercising, I'm doing anything that I can to make other people happy because they care about me so much.
I try and do something every day that I think, yeah, my donor would be proud of me for doing this.
If there's somebody that wants to list themselves, I will not talk them into it, but make sure that they know it's okay, it's gonna be better in the end.
You know, just remembering that someone is not here, but I am, and I want to remain grateful.